Hi, everybody. My name is Andrea Pocket, and I am president and co-founder of the Stigma-Free Mental Health Society. Welcome to our podcast today. I am super excited as we have a wonderful guest, Paul Adams. You want to say a quick hello, Paul?
Hello, everyone. Good morning. Paul Adams with the BC Rural Health Network. I'm the executive director of the BC Rural Health Network, which is a pan-provincial organization covering health and health needs across the province.
Perfect. Thank you so much, Paul. And we'll get into your bio in just a second, but wanted to let people know, first and foremost, Stigma-Free Mental Health Society. We have a rural mental wellness program, and we really invite everybody to come to stigmafreementalhealth.com and to look up this program, Rural Mental Wellness. We also just finished an amazing tour up in northern BC. Rural Minds Matter, leading together with resilience, doing some town halls. And yeah, we're really excited about the work that we've been able to do in this space and to partner with individuals like you, Paul, and also the BC Rural Health Network. So we're going to talk about your organization today, a little bit about yourself. And first, I think it would be a great opportunity to share your bio. Does that sound good?
Sounds good, Andrea, and
All
thank you
right.
for all your work.
Yeah, thank you. Okay, so Paul, serving as the executive director of the BC Rural Health Network, has demonstrated exceptional leadership and dedication in the realm of rural health. With a rich background spanning various leadership roles across both the nonprofit sector and industry, his expertise has been pivotal in steering the organization's growth. Under his guidance over the past 3 years, the organization has transformed into a pan-provincial force, now encompassing 72 organizations. That is absolutely outstanding to see that collaboration. 32 municipalities, 2 regional districts, and 25 individual members. Stigma-Free Mental Health Society is definitely a part of these partnerships, and very proud to have you here today. So I think the first question simply, let's talk about what are some of the biggest challenges that rural residents in British Columbia face when trying to access healthcare, both physical and mental health services.
Well, as you know, we live in a massive geography in British Columbia, and the distance people need to travel to care is probably the biggest barrier in accessing care. And so the more rural, the more remote you are, the more challenges and the more isolated people tend to become. And the amazing programs that are available to people are sometimes limited also by their connectivity. So it's not just a physical distance, but sometimes it's a disconnect from systems which can serve them from a remote location. So people face many challenges, but especially in regards to travel, to seeking care, and to accessing care from remote means.
Yeah, no, definitely. I think too, as well, we can talk about how living in rural and remote communities affect mental health outcomes, especially when access to care is delayed or unavailable. Can you speak to that a little bit?
Yeah, for sure. So, again, we live where we live, some of us by choice and some of us not. So, when you are in a province the size of British Columbia and you live in a rural community, you may be hours from the next available service and community.
Mhm.
And that in itself is a significant barrier to accessing healthcare and to mental health services. And the nature of people living in rural BC is that we tend to be independent, and we tend to be feel that we're able to look after our basic needs. But at times, we all need help. So reaching that help and getting that assistance is a huge challenge to many people living across the province. And
Definitely.
yeah,
Yeah. Go on. Sorry.
so no, so I think that we see that delay in access creating further problems and compounding problems for people.
Yeah.
So if you don't have a primary care provider, if you don't have a facility within your community where you have resources available to you, then you become reliant upon your access to the internet. And again, the issue there is that people tend to provide misinformation and poor information. So having resources and programs available through groups like Stigma-Free really do provide valuable services to those living outside of urban centers.
Yeah. Well, I also think sometimes too, Dr. Google is the way a lot of people go, cause themselves a lot of anxiety. I know I've done that in the past. Finding good resources that are reliable, evidence-based, and effective can be difficult, especially if people don't have direction on where to go or what to look for, right?
Yeah, the misinformation is afoot, and we find that there is a lot of groups which are not providing good information to people,
Yeah.
and there is even deliberate attempts to undermine people's well-being that come from sources which are not qualified to provide
Mm.
information to others.
Good.
So you really have to be very careful when you're on the internet and you're trying to especially when you're dealing with mental health issues,
Yeah.
is that the lack of good resources that are available. There's more poor information than there is good information. So
Sure.
just be careful on Dr. Google does more harm than good, I believe.
Yeah, I agree. So you've said that housing is healthcare.
Yeah.
And I was wondering if you could explain what that means and how lack of housing or accommodation impacts rural residents needing medical care in urban centers. So housing is healthcare. Can you just share a little bit more?
So we've entitled one of the projects that we're working on as Housing is Healthcare. It's looking at how um, people need to travel outside of community in order to seek the care that they need, and in doing so, end up in financial difficulty
Mm.
when they reach the care provider. So many people in BC are traveling to larger centres in order to seek the care that they need, whether that is physical care, whether it's mental health care, and in doing so, the out-of-pocket costs become prohibitive and they become a burden, and that becomes a barrier. So
Mm.
if people are not seeking the care that they need because they can't afford to, then we have a real challenge and a compounding issue, which happens for rural residents.
Yeah.
So if you're living on a limited budget, you now have to travel, several hours to reach the appointment. You may have to stay overnight. You may choose not to seek that care. And so part of our effort and part of our work is bringing awareness to governments and ensuring that we are afforded the rights that are provided to us under the Canada Health Act. So
Yeah.
Canada Health Act, Section 12.1 A, states that every insured resident in the province must be provided with reasonable access to care. And that's really a founding principle of our organization is getting people to care, having it done in an equitable and reasonable way, and ensuring that the financial burden isn't put on the back of the patient, and that we do have a strong public universal health system that doesn't treat you based on your postal code, but on the need of you as an individual.
Yeah.
And that is, I think, what makes us Canadian from a healthcare perspective is that we have this protection and this insurance policy, but we have to make sure that the insurance provider lives up to the commitment of that policy, and that insurance provider is our government, the government of British Columbia.
Yeah. Is there any help with transportation or government funds to assist with people getting the care they need? Do you know?
So there is a variety of different programs. Most of them are run through organizations such as ours, which not ours specifically, but I mean as in charities and nonprofit organizations that are providing services to others. So Hope Air is one of these travel providers, which is a charity that is a national-based charity, but does the majority of its work here in British Columbia, and was unknown to many people within rural and remote communities. Mm-hmm. And part of our role as an organization has been to promote and to provide awareness to people that these services are available to them. So in doing that, we drove awareness to this program. Mm-hmm. That increased the rate of use by over 150%, and then the following year by an additional 75%. And so that all sounds very good that we made people aware of the programming. But the challenge is whether the dollar flowing to that organization follows the demand for their services. And unfortunately, it didn't. And so instead of being able to provide the services that we were promoting, they had to reduce some of those services. So they still provide very good service. And Hope Air does amazing work in flying people from community to larger centers. But that housing as healthcare piece is still a missing component. We still need to be able to provide accommodation for people on the other end. Yeah. Another excellent program is the Canadian Cancer Society. And they are also working in conjunction with Hope Air, but anybody with oncology needs within BC can apply for funding through the Canadian Cancer Society. And they too will provide travel in conjunction with Hope Air. And they'll also provide you with lodging for yourself, a care provider, and for meals when you reach the treatment center. So all of those things really do alleviate a lot of stress and burden on people, and we need to make sure that people are aware of these programs that exist. Yeah. We don't have a lot of resources for mental health and for travel and support, but there is being some, there's more investment going into mental health resources for certain groups of the population, but not for broad policies around mental health resources. So we definitely need to see more in the area of mental health, and we don't need to. Again, I think we do too much in the emphasis of mental health versus physical health. I think they holistic health. We really need to look at people from the top of their head to the tips of their toes, and not to isolate conditions as being, the reason for providing assistance. People in need are people in need, and we need to make sure that they can access the care they need.
I love that. I always say physical health and mental health need to be treated the same with dignity and respect. And I feel that's so vitally important. And you make a very good point. There's so much that needs to be done. And so I commemorate you and your organization for making so much awareness around what is available, but we all will continue to work together to advocate for what people need in rural communities. And speaking of rural communities, and I was wanting to touch on emergency rooms. I know that there has been closures in rural BC. And what does that mean for the community when their local ER is closed or even temporarily? Have you seen this in British Columbia, in rural British Columbia at all?
Unfortunately, it's becoming a weekly occurrence, if not a daily occurrence, across the province. We have seen a small improvement, but the problems endure. So this last weekend, May long weekend, we had 3 emergency rooms closed in the province, and 1 in the north and 2 in the interior. And there are emergency rooms that have been reduced and closed for periods of the day now, which were put on temporary closures, which have gone on for years. And we tend to start to forget about those emergency rooms, and they become business as usual. Is now a reduction in hours of operation. And these are, life-saving facilities. These are necessary. They are all situated to ensure that people have a reasonable distance to travel. And if you live in an urban population, if you're in the Lower Mainland, and if a facility was to go down, there's numerous options for you as an individual within that same reasonable distance. If you're in northern BC, as you just say, you were on a tour of northern BC. If you're in Fort Nelson and the emergency room goes down, you have a 4-hour commute to the next community, and there's no commercial air traffic. So it's you become truly isolated. If you're on Haida Gwaii, you face similar challenges, or in the Bellas. So across BC, we have these communities, 850 unincorporated communities in British Columbia, 204 First Nations in British Columbia. Many of those nations have multiple communities within their traditional homelands. And so we have all of these individual scattered communities, and providing access to care is critical in keeping emergency rooms open. And we're doing an effort and a push right now to add some urgency to that need. We see that there is good work being done for future planning. We're building new medical schools. We're getting more nurses into play. We're expanding facilities. We're building new facilities. We're getting into long-term planning, which has been missing off the landscape for a couple of decades, and we've got a lot of catch up to do on that aspect of the work that needs to be done. What we feel is not happening is urgency in a crisis. Right. So when you're in a healthcare crisis, which rural BC really is, we need to apply emergency measures. So we need to keep those doors open. We've unfortunately seen people have very poor outcomes and deaths because of the doors being closed when they arrived at an emergency room. And the stresses and the strains put on the healthcare system compound the problem. So we see healthcare workers who, I was in a room full of physicians not too long ago, where many were embraced in hugs and supporting each other because of the mental strain that they were faced on their daily work. And, extensive hours, long overtime, on-call requirements, unhappy patients, people who were left waiting for too long of a period of time, and then the repercussion of that falling on the shoulders of the healthcare providers. So the mental health support system needs to also cover those who are providing the physical care within our emergency departments as well.
Yeah. Wow. Being from Medicine Hat, we call it rural, but really it isn't as rural as many places in British Columbia. Here in Alberta, for myself, we have a city that is 70,000 with population, and I was able to get a doctor within 2 weeks of moving to Alberta. And I even find sometimes in urban areas, it's really tough. In British Columbia, was on a wait list personally for myself for 4 years and never even got a GP. So I can't even imagine the stress and the feelings of isolation when people are trying to get this kind of care in the north and rural areas. And do you have a story of somebody who has attempted to get help? I know there can be a lot of feelings of isolation and hopelessness, but maybe a story where it has a positive outcome, or if not, but just want to get a feel for how people are experiencing this crisis.
Yeah, so the sad end of the story is when obviously some of the worst case scenario is when people their life is lost because the facility is closed and that people are not available. The impressive and the positive side of these stories is when community comes to help. Yeah. And I think again, this is the healthcare community is not a individual, and that we have this thought and ideology that you need to be connected to a single provider. And I think that in reality, our needs are to be connected to community and to the provision of care within community and the team-based aspect of community. So again, the more of the holistic look at health. Within the emergency department, that is, when you're in the, the point of need where it's an immediate need that you have. And unfortunately, those emergency departments are also becoming more than emergency departments. They're screening out people who have primary healthcare needs that don't have a doctor. So they're dealing with simple things like prescription renewals, but they're also becoming mental health facilities, addiction treatment facilities. They're becoming this, more than they should be, and more than their skill set allows them to be, which again adds to the burden and the problem that's placed upon them. I think that the spirit of rural and the independence of rural are also problems, because we tend not to speak out, and we tend not to make demands on what we are actually provided as a right under our Canadian health system. So we need to be more vocal, and we need to come together more, and we need to ensure that our voice is united, and that we can't keep putting out fires. We need to create systems and redesign systems with intent. And that intent needs to be to create not only a good place for you in your moment of need, but a good place for healthcare providers to be as well, so that they feel that they're rewarded, that they feel that they're able to practice their skills and their craft, but they also have a personal life outside of that, and that becomes a real challenge for healthcare providers. So I think, we need to get out of our silos and work as a community to improve healthcare more broadly. And emergency departments are, they're a critical aspect of the community, but they're not the only aspect. So if we, in the communities where we see some really good things happening, is where the community has come together, where it is creating and defining and providing health more broadly, bringing services to people, accepting people for who they are, where they are, and not having expectations of them to fit a certain criteria in order to seek care. And I think that that work is, being done in many communities that have a good community spirit. But for those that don't, then we need the system to step in and provide similar mechanisms and provisions to those communities that are in need.
Yeah. And I really love what you say about creating new frameworks, new structures, new ideas, and innovation of ways that we can approach this issue that we haven't in the past. And I think this leads into health equity. And I was wondering if you could tell me what that means to you further. I know we've touched on this, but health equity in the rural context, and how people living in urban settings can support these goals.
Yeah, I think, again, the term which is used within the Canada Health Act is reasonable access to care. And that is very broad. So what does reasonable mean? What is our definition of equitable? It's certainly not equal. We don't expect to have brain surgery in a small town. We don't expect to, have open heart surgery happening in hamlets around the province. So there's definitely not going to be equal care. But equity to me means that we are provided care no matter of how we present. So if we're coming with limited income, if we have moderate income, it shouldn't be determining our outcome. We shouldn't be determining outcome by postal codes. We shouldn't be determining outcome by diagnosis. So, if we have a program for oncology, which is definitely needed, and we have an amazing program right now in BC covering oncology needs, we should also have those same provisions for any other life-altering situation. And if that's a mental health situation, but why are we qualifying who gets care by what their diagnosis is? It's the need of the patient. So that's really what equity is. And again, it shouldn't be whether you're what your cultural origins are, or what your ethnicity is, or what your age situation is, or It shouldn't be based on your intellect. It shouldn't be based on your profession. We need an equal platform where everybody is given reasonable access to care, and that care should not cause you either physical or financial or mental harm. And that is what I see as being equity.
Thank you for explaining that to me personally. I didn't know what that meant as a whole, and that creates a lot of understanding and awareness for our viewers as well. So thank you so much, Paul. I always really appreciate connecting with you and love seeing the good work that you do, and look forward to more collaboration with your organization and yourself with Stigma-Free Mental Health. And I was wondering if you just wanted to close off, maybe some words for people who are struggling in rural communities with their health. Is there anything you can share that maybe can uplift them?
Well, I think I, as many people, have struggled with my mental health, and I think that part of our nature in living in rural is we tend to be independent and somewhat isolated, and we're used to working within that space. But our neighbors are critical to us. We rely on people within our community, and that we have seen a large migration of people from urban centers into rural community that haven't necessarily understood the challenges that they may face in their relocation and in the isolation that often does create. So I encourage everybody who is watching and listening to connect with your communities, to understand who your neighbors are, and to reach out and utilize those people as peer support systems, and to find resources. Stigma-Free Society provides some amazing programs and services, and we would strongly suggest that you access and utilize these programs, which are going to help you and your family moving forward. And we've seen some traumatic events that we expect will continue in regards to natural events and forest fires and flooding and events which are causing people to have additional anxiety and concern as we move into the summer. And again, the resources that are available to you for support really happen at home. They happen by connecting with your community, understanding more about the challenges that you may face. And if you've moved to a rural community for retirement, if you're an aging individual within community, don't forget that you need to connect with people in the place that you live, and that the supports that you're going to find are going to be rich and valuable if you make the connections within the towns that you live in. And reach out, find out what's available for you, find out social events that are available, get involved in volunteering and in providing more back to your community. All of these things will help you not only engage more and feel more at home, but in times of emergency, those people will be coming to assist and help you. And that's an important aspect of rural life. It's the networks we create, it's the people we know, and it's the friends we have.
Beautiful. Yeah, we'll be having another cohort of rural peer support training at Stigma-Free Mental Health Society in the fall. So the sign up list on our website is available now. And thank you for mentioning peer support, because it is about neighbors helping neighbors and being connected to those in our community. How, we are social beings as humans, and we need to be connected. So I really appreciate you pointing that out. Where can people find your organization, BC Rural Health Network? And would love if you can state your website and any way people can get in touch.
Yeah, I think you'll find we come up on your search engine right away. If you type in BC Rural Health, we'll be there, but it's bcruralhealth.org. We do also reach out on social media platforms, but we have a resource base on our website which provides programs and information on a variety of areas, including mental health resources and access to stigma-free programs through our website. You are welcome to join us as a member. We have, again, the ability to include your voice in our voice, increases our ability to move programs, to change systems, and to advocate for better health for all.
Perfect. All right. Thank you so much, Paul. Please stay on the line, and I could say goodbye to you after the fact. But anybody who is watching currently or after we post this podcast, please feel free to share. Really appreciate everybody who watched today. Much appreciation to all of you. And as Paul and I have stated throughout this podcast, stay connected to your communities. Know that your neighbors are there to support you. And please do check out BC Rural Health Network and come to our website, Stigma-Free Mental Health Society. And you can find some programming, our toolkit on our website, and a lot of the good work that you're doing at the network, Paul. So thank you so much, and really appreciate talking with you today.
I appreciate you, Andrea, and for all of your support and for help over the years, and for your continued efforts to improve people's mental well-being. Thank you very much.
Thank you.